Good day once again. Dr. Yakub is my name, Well-Life Hospital, Abuja. Today, in the series of our health talks, we want to talk about a common condition among women, among ladies, that we call bacterial vaginosis. Of course, I know a lot of women may have heard this, but they probably don't have appropriate information on it. So we want to talk about it, what causes it, how is it treated. Bacterial vaginosis is a condition whereby the woman develops discharge or vaginal discharge. In most cases, the discharge, or specifically the discharge, is a bit offensive. It has this fishy odor and it can be very embarrassing. And it's a common condition we see amongst women, especially women of reproductive age. Now, what causes bacterial vaginosis? Well, there are so many things, but maybe we should give a little background so that we understand how it comes about. The human vagina is usually inhabited by some organisms we call normal commensals there, and they're meant to protect the woman or the lady from invasion by other bacteria in particular. So these organisms survive there under certain conditions. One of that condition or those conditions is the pH, that is acidity or alkalinity of the vaginal environment. And this pH is regulated such that that environment becomes conducive for the survival or existence of these good and friendly bacteria. If for any reason this pH is distorted, or if the friendly bacteria is removed for any reason, then the bad ones come to inhabit the place, and then we have a condition called bacterial vaginosis. So essentially, it is not an infection per se, rather it is actually change in the population of normal and healthy bacteria that protects the woman. So once there's that change, the unhealthy bacteria inhabit the place and they create this situation. How do we develop it? As I said before, once you are in the habit of doing anything that changes the pH of the vaginal environment, things like douching, for instance, or the use of some substances, surprisingly including family washes, some of them that are a bit more alkaline, the use of some traditional stuff. We see women who come around, they use certain things down there actually that they are not supposed to use. Maybe some, in attempt to tighten the vagina, they use all kinds of substances there, and some for maybe an enhancement of sexual pleasure or whatever it is. So in doing so, they change and distort the bacterial flora of the vagina, or they actually change the pH, thereby discouraging the survival of those friendly bacteria. So they develop this thing. The use of antibiotics. Sometimes women have had reasons to use antibiotics, especially for a long time, treating other conditions. Well, they treat other conditions. The truth is that each time you use antibiotics, the antibiotics do not discriminate. They go and clear almost everything in you that is sensitive to those antibiotics, so including your normal flora sometimes. And so where you use antibiotics for whatever reasons, and those antibiotics go down there and clear the bacterial population in the vagina, then you stand the risk of developing bacterial vaginosis. Sometimes washing yourself with antiseptic soaps or solutions in whatever form may predispose you to bacterial vaginosis. And so it is important to note that we don't have to be over hygienic when it comes to personal hygiene relating to the vagina. What is recommended is do not use anything, any substance, anything beyond water. If anything, maybe salt water, but don't use any soaps, don't use any antiseptic things to wash yourself down there. Otherwise, you stand the risk of clearing your normal flora that protects you, and therefore you may develop bacterial vaginosis, and it can be very embarrassing. How do we know when we have bacterial vaginosis? Usually the characteristics is that there's this very offensive discharge that may come up, and it's watery in most cases. And so that discharge comes, and characteristically it has a fishy offensive smell. Sometimes how we know is during your period, you may not have the discharge so much and the offensive odor may not be very obvious to you, but during your period, when blood starts flowing, the blood smells very badly. Or some other times, it is only maybe when you meet your partner, your spouse, and afterwards you begin to smell, you begin to have that fishy odor coming up. Essentially, the characteristics is an offensive vaginal discharge, and it can come in different or manifest in different forms, either during periods or intercourse or even on its own. Some women will present to you and tell you that they know that something is wrong down there. By the way, the bacterial vaginosis does not usually come with itching. So let's differentiate that. If you have a vaginal discharge that comes with itching, especially cheesy, whitish discharge, it has its own characteristic odor, could be candidiasis. So how do we manage vaginal bacterial vaginosis? Please, we've seen patients or we've seen women who develop bacterial vaginosis and then worsen it by the mode of treatment. And so it is important that you approach someone who knows this, how to manage this. There are specific antimicrobial agents that we use in treating bacterial vaginosis. Please, it's important to approach a healthcare provider who knows what bacterial vaginosis means and what it is, and who knows the appropriate medications to use in this diagnosis. Now, it is important also to know that commonly, the diagnosis is not based on high vaginal swabs or anything like that. Usually, there are characteristics, there are criteria that the healthcare professionals use to make diagnosis. And once the diagnosis is made, then of course appropriate treatment is given. In most cases, it is frustrating to treat and it has a high recurrence rate. But as long as you have it, please make sure that you approach your healthcare provider and he or she will assist you in curing it. And try as much as possible to make sure that you do not indulge in those things that will further predispose you to acquiring this situation. So we hope that this information will help you to prevent it. As they say, prevention is better than cure. And when you contract it, please approach your healthcare providers and then you get appropriate care. Thank you.